morning, girls. This is a video describing the treatment for transsexualism. In the previous video we have looked at what transsexualism is, so I directly move on. Sex reassignment surgery seems to be the most effective treatment option for transsexualism. Psychotherapy is not very helpful in helping adolescents and adults with gender dysphoria. However, those desirous of having a sexual reassignment surgery should live with a hormonal therapy and live as a gender they wish to become for at least a year. If they complete this trial period successfully, they undergo surgery and continue to take hormones indefinitely. So this is what happens with respect to male to female transsexuals. Biological men who wish to become females are given estrogens to facilitate breast growth, softening of the skin and shrinking of muscles. The male sexual organ is removed and an artificial vagina is created using a penile tissue. One fascinating study by Lawrence et al. In 2005 showed that transsexual near vagina is sexually functional. That is, they showed signs of sexual arousal to male erotic stimuli if the person was a homosexual transsexual. That is, a male who thinks that he or she is a female and therefore he or she is attracted to a male erotic stimuli. But that is not the case with autogynephilic transsexuals. Autogynephilic transsexuals showed signs of sexual arousal to female erotic stimuli. This again kind of validates the difference between the two types of male to female transsexuals. This happens with respect to female to male transsexuals. Biological women are given the male sex hormone testosterone, which suppresses menstruation, increases facial and body hair and deepens their voice. They are also given mastectomies and hysterectomies, that is removal of their breasts and uterus. However, only a small subset of female to male transsexuals seek an artificial penis. This is because the surgery that is required, the surgery that is done to create an artificial penis is very primitive and expensive, and such artificially created penis is not sexually functional. That is, these people still require other kind of artificial supports to have intercourses anyway, and some people can continue without function sexually without a penis as well. Outcomes of sex reassignment surgery. Your book gives you extensive statistics about the number of people who seem to be satisfied with sex reassignment surgery. There seems to be some set of problems, like people participants are reporting less satisfaction with vaginal lubrication or vaginal touch sensations and all of that, but still the overall satisfaction seems to be very high, and majority of transsexuals are satisfied with the outcomes of the sex reassignment surgery. On the psychological front, however, transsexuals who had sex reassignment surgery were less well adjusted compared to normal controls. But you all know that a better comparative group would have been those who are desirous of sex reassignment surgery but have not been given sex reassignment surgery. But studies of this kind seem to have not been done. In spite of the reasonably good record for transsexual patients who are carefully surgeoned, such surgery remains a controversial issue because some professionals continue to maintain that it is inappropriate to treat psychological disorders through drastic anatomical changes. And that brings us to the end of this video. Thank you.